Again, welcome everybody, and thank you, Donna. My role this morning is to do a couple of things. First, what I'm going to do is talk about the presentation that you are about to hear. We have three terrific people here with us this morning who will each be presenting, and excuse me one moment while I give you their background and introduction while Rachel comes up and sets the program up for us. The second thing that I'll do this morning is give you a little bit of background on public policy and what the Alzheimer's Association Rhode Island chapter does from that point of view for all of you and for all of those who are living with Alzheimer's or related dementias. Let me put my glasses on. I think that would help me a little bit. Excellent. First of all, let me mention, or let me introduce those three individuals who I was talking about, who will give the presentation after me. First is Victoria, and by the way, all three are sitting at the front table here, so as I call your name, if you can give a friendly wave to the audience. The first is Victoria Parker. Victoria is the Alzheimer's and Related Disorders Program Manager at the Rhode Island Department of Health. She is there for all of you and for all of those who are living with Alzheimer's as a role in working with the federal government to support your needed resources or to help you get access to your needed resources and to implement the objectives within the BOLD grant that you will hear about in just a little bit from me. Dana McCants Derisier. Dana has over 20 years of experience in strategic planning, development, and implementation of programs and services that improve the well-being of all individuals and families living here in Rhode Island. Dana had previously been with the Rhode Island Department of Health, but is now serving in the Office of Healthy Aging in Maria's new office. So welcome, Dana. And Laurie Mantz. Laurie is an accomplished occupational therapist with over 30 years of clinical, managerial, and education experience. Over the last 15 years, she specialized specifically in dementia training, and she has lectured locally, internationally, and also at many Alzheimer's Association Rhode Island chapter events. She is here as the manager for a CareLink grant, and we are pleased that she will be presenting to us this morning along with our other two presenters. So once again, a welcome to our three presenters, and thank you for being here with us. I will move on to my portion of the plan, or my portion of the morning. Let me see if I can get this right. There we all are up there in the big highlights. Okay, real briefly, what I want to let you know is, most important, what I want to let you know is what we do from a public policy and advocacy standpoint, we do for two primary groups. Number one, and most important, are those living with Alzheimer's here in the state of Rhode Island. And number two, for all of you, those who are caregiving, be it family members, volunteers, non-paid, or professional caregivers. We are here to advocate on your behalf to both the federal government, our federal elected officials, members of Congress. We're very fortunate, by the way, that our state is small but mighty. We have 4 members of Congress, 2 members of the U.S. House and 2 United States senators. Some of our other chapters throughout the country are very jealous of us because they have dozens and dozens and dozens of members of the U.S. House, like California, for example, and it's virtually impossible to meet with them on a regular basis, as we do here in Rhode Island. Donna had mentioned earlier that we're a state where we think we need an overnight bag to come to an event like this, but we're also a state where we see our members of Congress in the grocery store, at the library, in the coffee shop. So we're very fortunate. And we bring our message to those members of Congress to your Rhode Island state legislators and to those who are elected at the local level on your behalf. And we do it with your support. We ask you to get involved with us through emailing your members of Congress and your legislators, texting those folks, calling them the old-fashioned way on a telephone or calling their office, writing letters to the editor, sharing your stories as caregivers and sharing your stories as those who are living with the disease by way of letter to the editor. Any way you can. Your message is the message that we bring to those elected officials, because these are the folks who, and I hate to say it this way or describe it this way, but it's a reality, they control the purse strings, especially at the federal government level, especially at the U.S. Congress level. We have been extremely fortunate that Alzheimer's research has increased by a spectacular amount over the last 12 to 14 years. When Donna first started advocating here in Rhode Island for increased federal funding for Alzheimer's research, the number at the National Institutes of Health was less than $150 million a year. Now we are very proud to say, thanks to Donna and to all of you, and to our federal delegation, that that number is now $3.6 billion a year. $3.6 billion a year, and we hope that it only increases. Last year we asked for an increase from the U.S. Congress of $269 million, and they gave us every penny. The great thing about lobbying for the Alzheimer's Association, which is what we all do, is that we don't have any enemies. We're not out for a specific cause that might have somebody disagreeing with you passionately. Everybody in the U.S. Congress, all members of the U.S. Congress, want to support us. It's just a matter of getting the money or having the available money to do the research. So we're very fortunate that last year we were granted every penny. We are now on to the next fiscal year. Believe it or not, it's many months before the federal government, the Congress, actually enacts a budget for next year, but we will be asking for an additional $226 million. And we'll be asking for that by way of all of you, emailing the senators and the reps that we have here in Rhode Island for that increase. We also have a program, which you'll hear about in just a bit, called BOLD, B-O-L-D funding. Both the federal government and the Alzheimer's Association love acronyms, but BOLD funding makes it possible for states across the union to get the message out about resources, about training, about research, and about things that affect those living with Alzheimer's and those caregiving for those individuals. So you'll hear a bit more about that. At the state level, from a state advocacy perspective, we have a number of bills, if you will, pieces of legislation that we're tracking, not the least of which is the state budget. The state budget is arguably the most important piece of legislation that the General Assembly hears each year or debates each year. And the Alzheimer's Association has a number of components in that state budget that we are concerned about. We have a dollar amount that we're asking for from the General Assembly. We're asking for $200,000. I mentioned California earlier. $200,000 is lunch money for the General Assembly in California. $200,000 is what we're asking for so that we can permanently put an Alzheimer's program coordinator into the ranks of the Rhode Island Department of Health. So we can permanently, if you will, have Victoria as a state employee continuing the great work that she's doing already. So that's in the budget. We're asking for help on that. It's one of our main priorities. We're also asking for additional Medicaid reimbursement. Medicaid, as you know, or perhaps you don't know, but many of you have had to deal, I'm sure, with the federal government related to this. Medicaid is a federal government plan run through the state of Rhode Island and run through all 50 states, frankly. It takes money granted by the federal government and it transfers it down to different state departments in Rhode Island, and the money is used to support services like Alzheimer's care and many, many other services. The state budget has many legs in its table, but the Medicaid portion of the state budget is one of the largest. It is now somewhere in the neighborhood of $1.8 billion, and that's on an approximate $8 billion total state budget. So we are asking for additional Medicaid reimbursement dollars for home and community-based services and for our friends who are often the lowest paid individuals in caregiving. And that is to say, our friends who are at long-term care facilities as homemakers, as CNAs, and as caregivers. If we are to get an increase, or if we are able to get an increase from the state of Rhode Island for those Medicaid reimbursement dollars, the Alzheimer's Association Rhode Island chapter is strongly advocating for those individuals to get a pay raise and for those individuals to be taken care of before we lose more and more of them from our ranks. Because frankly, as you all probably know, we have a tremendous shortage in that area. So we're looking for support at the Medicaid reimbursement level, at the direct dollar level, and then we're also looking for support, frankly, for a Medicaid rate review commission, where we will have an automatic rate review at a minimum of every 3 years. Minimum of every 3 years, so that we are able to deal with the rising costs of providing care, inflation, and others. Right now it's done on an ad hoc basis. We want to put it more in a permanent way into the state budget and into the state operations. So we've got a lot going on at the federal level and at the state level. I've already taken up far too much time. What I want to do now is I want to introduce formally our first speaker for the remainder of the presentation, and she will then introduce the other two. So if we could, welcome Victoria to the stage. And I'll pass the microphone off, but I'll put it into the holder for you first. Why don't we welcome all three, actually? Victoria, Dana, and Laura. Thank you.
Good morning, everyone. I'm Victoria Parker. As David mentioned, I'm the Alzheimer's Disease and Related Disorders Program Manager at the Rhode Island Department of Health, and I'm really thrilled to be with you in person this morning. I'm very much used to giving presentations on Zoom, so I'm checking for mute and making sure you can see me okay up here. I want to start by introducing our learning objectives for today, and then we'll really get into the meat of some of our federally funded programs for you that David mentioned in his opening remarks. Our learning objectives, after participating in this presentation, we hope that you'll be able to describe a few initiatives from our work plans, identify how to access evidence-based programming, and understand how statewide partnerships are creating dementia-capable community services. So to start, Rhode Island has received some significant federal funding to continue to support and provide resources for people living with dementia and their caregivers. And in the next couple of slides, I just want to briefly mention what those federal funding sources are. The BOLD funding, which David did mention, comes from the Centers for Disease Control and Prevention, or better known as the CDC, which I'm sure you're used to hearing at this point. And the hope is that the program will address Alzheimer's disease through a public health approach. And what we mean by that is including a focus on risk reduction, or strategies that identify and reduce the risk of Alzheimer's disease, and early detection, meaning diagnosis that happens early within the disease progression. And the Rhode Island Department of Health has received this funding, and I'll be talking a little bit more about some of those specific objectives a little later on. The other funding source I want to mention is the Administration for Community Living, which has created funding for state agencies and community-based organizations to apply to, and that is called the Alzheimer's Disease Program Initiative, or ADPI. As David mentioned, we do love to use acronyms, so you'll see some of those throughout the slides. This funding exists because research indicates that about half of older adults with dementia do not have an accurate diagnosis or any at all. The Rhode Island Office of Healthy Aging is the state agency in Rhode Island that has received this funding, and CareLink is the community-based organization that has received ACL funding. So why does it matter that we have this funding? Federal dollars coming into Rhode Island specific to Alzheimer's disease and related disorders is important. With funded programs, we're able to increase awareness and access to quality care, promote provider education and public education. We want providers to be equipped to diagnose and deliver the best care possible. And we can identify and remediate gaps within communities, and we can improve coordination of dementia-related programs and resources across the state. So you're probably asking yourself, with all of this funding, what have we set out to do? Between our funding streams, we do have some similarities, and you'll see in the middle here, I'll direct your attention there to the 4 bullets. Both the BOLD and ACL funding programs are similar in that we focus on public education, provider education, caregiver support, and community partnerships. And on the outside of the circle are some initiatives that are more unique to our programs, and we'll be talking about those in the next few slides. As the program manager at the Rhode Island Department of Health, I'm excited to share with you some of the specific objectives that come right from our work plan and some of the things that we aim to achieve. And I want to start by talking a little bit about the framework of our funding and why CDC thinks this is important. The CDC identifies Alzheimer's disease and related disorders as a public health crisis. We know that Alzheimer's disease will continue to grow and affect more individuals. We know it's extremely costly to our healthcare system, and we know that it impacts informal caregivers, many of you here in the audience today, sometimes at significant cost to your own health outcomes. BOLD funding requires public health agencies and their partners to align with something called the Healthy Brain Initiative Roadmap. This means acting quickly and strategically to prepare communities so that they're best equipped to support those living with Alzheimer's disease and related disorders and their caregivers. The Healthy Brain Roadmap includes 25 actions of public health that leaders can use to promote brain health, to better care for people with cognitive impairments, and to increase attention given to caregivers. The circle image that you see on the slide is a conceptual framework for the Healthy Brain Initiative Roadmap. And along the outside of the circle, there's 3 core principles that guide our work. Those are to eliminate health disparities, to collaborate across multiple sectors, and to leverage resources for sustained impact. Also on the slide, you're going to see the domains of public health where the roadmap actions stem from. And you can see those include workforce, which David mentioned as well, monitoring and evaluating data, educating and empowering individuals with dementia and their caregivers, and developing policy and mobilizing partnerships. And this is the framework that I use to drive a lot of the work that comes from the Department of Health. So here's my favorite part of my presentation, where I can actually tell you some of the things we're aiming to do. One of my favorite work plan objectives is the development of what we call a surveillance system. And this is a tool that will monitor Alzheimer's disease and related disorders in Rhode Island. And essentially, it's using data to make informed decisions. And when we know how many Rhode Islanders are experiencing cognitive decline, or how many caregivers are developing chronic conditions, we can make informed decisions and support their needs. Dementia-friendly communities is another initiative we're working towards, and people with dementia can be our neighbors, our friends. We know that an accessible community can allow for greater socialization and independence to remain in the community where you hope to age. We plan to increase awareness with places such as banking institutions, public transportation, places like restaurants and hotels where you enjoy going to. We know that people living with dementia want to feel included in the community, and that is our hope by creating additional dementia-friendly communities. The Cranston Senior Center, I do want to make a plug for them. They are pursuing a dementia-friendly community recognition right now, and they've created training videos that they have hosted with various public organizations, restaurants, hotels, banks. Moving to quality improvement. In the BOLD work plan, we plan to engage primary care providers in our work to educate on the importance of early detection and diagnosis and how that impacts quality of life. I like to imagine a future where cognitive screening is just as common as taking a blood pressure in your primary care appointment. And lastly, we have an advisory council and a state plan on Alzheimer's disease and related disorders. Our work plan objectives, keeping those all in mind, we utilize our state plan and we use that to guide our work. We also lean into our advisory council, which is made up of thought leaders from various community-based organizations, state agencies, and caregivers. And members of the public, you all are welcome to attend our meetings to share input and ideas about things that really matter to you. So this is just a taste of some of the initiatives that we're working on at the Department of Health. I hope that this gives you some insight into some of the things that I work on a day-to-day basis with our community partners. And I want to pass it over to my friend and colleague, McCants Derisier from the Office of Healthy Aging, and she'll be sharing some specifics about her work. Thank you.
Great. Thank you, Victoria. I'm going to pull this down. Victoria's tall. Hi, I'm Dana McCants Derisier from the Office of Healthy Aging. I am the Community Living Director, and as stated earlier, the Office of Healthy Aging has been given funding from the Administration for Community Living to do the Alzheimer's Disease Programs Initiatives, which is a great initiative. I should be moving this on. There we go. And we also have a work plan that outlines the goals and objectives. Part of this funding we've used, and the goal of it is to have a dementia-capable community-based services. This system of services really helps providers to identify, diagnose, and refer care planning processes for those with Alzheimer's disease and related disorders. Also in this system, we educate healthcare providers and professionals and public about brain health, risk factors, and just to the first sign of cognitive issues. And we also provide services supportive to individuals living with dementia and their families. The benefits of having this dementia-capable home and communities-based services is really to help increase visibility, access, and responsiveness to support programs and resources for all of you out there. Also, we want to maximize the individual's ability to maintain their independency in the community. Now I want to go on to our work plan. As Victoria was saying, this is the exciting part of what we do. The first of the work plan is education and training. We couldn't have done it without partners in the community that have helped us, OHA, Office of Healthy Aging, to move the programs through the Alzheimer's disease program initiatives. The first of our partners is the Rhode Island Geriatric Educational Center. They educate and provide primary care practices on identification of Alzheimer's disease and related disorders and refer them to services. This is a great program they've been initiating and establishing for a while now. And also, through this partnership with all of our agencies, we have developed a provider referral packet. And this packet really gives the provider the opportunity to learn more about Alzheimer's disease and related disorders, as well as giving them the opportunity to bill for dementia-related services. Our other partner is the Rhode Island College. We appreciate all the work they're doing to train direct service providers, to encourage them to use Alzheimer's disease and related dementia skills. Through the Dementia Competence Practice Training, they get a lot of skills and to learn how to identify, diagnose, and to refer to services as well. The second objective is support for caregivers, persons living with dementia. Another partner is Catholic Social Services of Rhode Island. They offer powerful tools for caregivers, and this is a great program for caregivers. It gives them the opportunity to learn about self-care, to go and learn about care planning with providers and their family as well. The Alzheimer's Association, the Rhode Island chapter, offers Living with Alzheimer's for People with Dementia course. This is a wonderful course because those living with Alzheimer's disease and related disorders, it really helps them to learn more about what to expect in the disease progression, and to also get with their family and providers as well. We know that the Alzheimer's Association has resources, and you see the 1-800 number right above me. And last but not least is our Aging and Disability Resource Center. This is administered through United Way, The Point. They are literally the central point of entry for resources. They provide wraparound services and supports and referrals for individuals with Alzheimer's disease and related dementias and their families. What's most important is the services include options counseling, information and referral assistance, with follow-up and routine check-ins as well, and caregiver well-being, and assistance gaining access to other services. And we appreciate The Point being a part of our partnership because they really are the hub for all of our services. If you ever need assistance, call them at 401-462-4444 or dial 211. And now I'd like to hand it over to Laurie for the next part of the presentation. Thank you.
Thank you, Dana. I'm going to bring my computer up. Technology is not my forte. Good morning. It is an absolute pleasure to be here with you today. I am here on behalf of CareLink, a nonprofit organization that brings programs to the community for people in their homes, wherever they call them home. But what I'm really excited about is the grant that CareLink received from the Administration for Community Living that is going to be bringing evidence-based therapeutic programs to you. We actually know, with all the research that's coming through with neuroplasticity, that we can actually treat some of the symptoms that come along with the diseases that cause dementia. So we are really, really excited that we're actually going to be able to bring these to the community and to your homes. So we look forward to providing some of that information. So the two therapeutic programs that we're going to be bringing, one's called Skills to Care. and that is delivered by our occupational therapists that works directly with the care partners, working with the issues that you're dealing with at home and some of the behavioral responses that you may see that are related to dementia. The other is a program called cognitive stimulation therapy. If anybody's familiar with the memory cafes that we started a couple of years ago, well, cognitive stimulation therapy is like memory cafes on steroids. Really excited about bringing this to the community because it actually has shown that both of these programs improve independence, they reduce the behavioral responses and challenges with dementia, improve quality of life for both the individual living with the disease as well as their care partners, and improve social engagement and cognition. So our work plan, first of all, we're looking to close the gap on Alzheimer's disease and related disorders and their services. Working in continuation with the grant that Office of Healthy Aging is closing up. We received our grant in November, and I'm really excited to say that we are now ready to start taking names and almost ready to launch those therapeutic programs. What will we be doing? We'll be providing support and resources. That support and resources will be providing some care consultation and care management, as well as connecting you to other resources in the community and making sure that you are getting the services that you need. Adding the evidence-based interventions and rehabilitation services. We know that with this intervention, we can actually improve the quality of life for individuals living with the diseases. So it's important that early detection and early diagnosis allows us to bring those services in as early as possible to help you adapt and change your environment to make it as independent as possible. We're going to be working collaboratively with healthcare providers and participants in their homes and in the communities. And we're going to extend those services to the underserved population, individuals living with intellectual disabilities and developmental disabilities, individuals living alone that are living with Alzheimer's disease and related disorders. We know that actually about 50% of those individuals that are diagnosed are living alone. And for individuals with behavioral responses to the diseases. Finally, multicultural, ethnic, and multilingual lingual communities. So we are going to be incorporating a new web-based translation service that we will be able to provide their home language to them at the time of treatment. So, what does all of this mean? And what do all the objectives mean? Not only mine, but also for Dana's and for Victoria's. And what does it mean to you? Well, first of all, for the care partners. With all of these programs, we plan on improving the dementia-capable communities, improving your access to social opportunities and daily activities. You can enjoy those experiences with your loved one, with people who understand your unique needs. We'll provide support and resources, additional services to meet the needs of both the person living with dementia and the care partner. Your health matters, and we know that caregiving can have an impact on your health. Early detection empowers individuals living with dementia to be involved in the decision-making as they age. You can be an active partner in the process. For individuals living with dementia, you benefit from all the areas that the care partners do, as well as this will empower you to make your choices and needs known. Direct your care as you see fit. Understand the challenges and the changes you may face and put adaptations into place, and to connect with resources to help you adapt. For our professionals out there, workforce development. I'm very proud and honored to be working with Rhode Island College with the dementia-capable and competent practices. And the one thing that we know, the more you know, the better we can care. Connecting those resources, it takes an entire community to provide support and care for individuals living with dementia. And transforming our systems, streamlining the approaches for service delivery that makes your job efficient and effective. And for our community partners, with your commitment, we can accomplish all of our work plans. As a community partner, you'll be part of a more coordinated care system, have access to additional resources and supports, feel competent and confident when working with people living with dementia and their care partners, and help us create access to experts across all industries. Annie has shared with me that she's planning on sending this presentation out to everyone in attendance, so you'll have access to the resources that are here, but these are some very specific ones that are in relation to our state plan, and also to the Administration for Community Living that is supplying the grants that allows Dana and I to do our services. So, what do we want you to know? In summary, we're here for you. Federal funding is supporting efforts that you can benefit from. Evidence-based programs be accessible to you in the community and in your homes. And partnerships will continue to develop to create a dementia-capable community and healthcare system. We are thrilled to be able to bring these programs to the community and hope to reach as many people as possible. On behalf of Dana and Victoria, I want to thank you for listening, and we're here for you.
Thank you so much, Laurie. Thank you so much, Dana. And thank you so much, Victoria. We appreciate the great presentations this morning. And there's far more to come. But what we'd like to do right now is turn it over to all of you. But before I do that, and Laurie just mentioned that Annie will, send on to you by email the presentation that you just saw, as well as contact information for each of these three individuals so that you can get in touch with them should you need any further questions answered or any resources. But I'd like to also share with you, if you don't mind taking down this number, it is the Alzheimer's Association helpline, and it is a lifesaver for many folks. Annie is a specialist with the helpline, but as you heard earlier from Donna McGowan, it is staffed 24 hours a day, 365 days a year, 200 different languages, and professional social workers and others are there to answer your questions about Alzheimer's or related dementia. And the number is 800-272-3900. That's 800-272-3900. And the number can also be found on just about all of the material that you will get today from the Alzheimer's Association as you walk throughout as you walk throughout the forum for the vendor tables. www.alz.org/RI. www.alz.org/RI is our chapter's website. We have a load of resources on our homepage and throughout our website for you to take advantage of as well. So now, let's open it up to questions. Annie has a microphone which she will pass throughout the building for any questions that you might have. And Annie, I see we have a few hands going up already. Don't be shy. Ask any question you would like. If we don't have the answer, we'll get it to you. And these individuals are here to assist you and answer your questions, as well as others who we partner with. Please.
Okay, good morning. This question I think would be for Dana. You mentioned about training at Rhode Island College. I'm thinking about the training that's required for CNAs, which I think used to be at CCRI. Is there a component for training, the required
Yes.
training for CNAs?
Yes, you can contact Rhode Island College. I can give you the number. They do have, with the Dementia Competent Training, CEUs, for direct service providers such as yourself. So, yes. And CNAs.
Thank you. I am the primary caregiver for my wife. We were high school sweethearts. We've been together since 1966. I'm exhausted. I do have home care, but with COVID and other factors, it's been sporadic. The one thing I need more than anything else is help at home. Dependable, reliable, competent help. I don't know where to turn. Now, I think from your presentations, I think maybe Dana is the person who can help me. And then
Yeah.
I think maybe it's United Way, the Point, or it's the Alzheimer's Association. I'm glad you said you're going to email that stuff to us, because I'm confused.
Absolutely. We'll make sure to get that to you. And actually, all three of the ladies here can answer your question, but I would also highly encourage you to call that 800 number. Again, it's 800-272-3900.
I've got that.
We're here to answer those questions, and we do it all for free. It'll be a starting point from there for you, but
Okay.
I'll turn it over, I think, Dana, as you said, but then certainly Victoria and also Laurie can answer the question as well. Excellent question. Appreciate it.
Thank you so much for sharing, and I know that other folks certainly have your sentiment as well. I would like to, and this is a great opportunity for folks to share and for us to have one-on-one conversations, so please see me afterwards. But yes, we, as I mentioned in the presentation, we've been establishing a dementia-capable home and community-based services. And what you're asking and your need is a part of that. And so the first initial point is calling United Way the Point. You can dial 211 or 462-4444 as well. But it's an opportunity for you actually to engage with us. I certainly want to, on your level, understand and meet your needs so that I can direct you better.
Thank you, Dana. And I would just add, again, thank you for sharing your story. I'm sure there are many others in the audience who are feeling a similar way this morning. I would certainly echo what David and Dana have already mentioned in terms of some of the helplines that are available to you. But this is a real challenge. Workforce is an issue. It sounds like a unique need in terms of home care is definitely a challenge. I think all of us in our work plans have some component of workforce that we are certainly focused on to help address that issue. And any sort of policy or statewide changes that we can make, we are certainly following that. So we hear your challenge, we understand your need, and I think for specific help, some of the helplines that have been offered this morning would be a good starting point.
So my question would be, if a person wanted to access help, they wanted to access help. So you hear so many different points of view, right, as to how to do that. Is it with a neurologist? Is it with a psychiatrist in testing? So my question to you would be, can you tell us what would be, in your opinion, not medical advice, the best approach to get the most definitive, the most accurate diagnosis for dementia? Is it the neurologist with the MRI? Is it the psychiatrist with the testing? What is it? Where are the steps? Because a lot of people are confused about that. They're sitting out there all over and they just say, no, wait a minute, I contacted so-and-so and they said go to a neurologist. I contacted so-and-so, they said go to a psychiatrist for a test. everybody's looking for that more constructive, definite answer. So can you help us out on that? That's one question, if I might. And the second one is, what are the early signs of Alzheimer's? In other words, what are you looking for that would say, hey, you should get tested for this? Those are the two questions.
Those are excellent questions, and we will give you the answers briefly here now, but I would also strongly encourage you to attend a session, and Annie's here, who has full command of the schedule of this conference. But Annie, will the doctor be with us this afternoon or tomorrow?
Told you technology was not my.
One of the programs that we offer at the Alzheimer's Association is our 10 warning signs session. And so I would encourage that you reach out to our helpline again and find out when the most current class on the 10 warning signs is available. You can do that virtually, in person, and we also have a course online. We actually have a session in the Plaza Ballroom this morning with Dr. Wu, who's a neurologist who's the director of the Rhode Island Alzheimer's Disease and Memory Disorder Center, who will be talking about diagnosis of different forms of dementia. But I always encourage that, if you are concerned about, yourself or someone who's living, may have some cognitive changes, that you should always, refer specifically right to your primary doctor first. And then they should have the knowledge and the expertise to know which specific physician or specialist that you should be seeing, that next step. So it is a process. Many times we think that, I'm just going to go to one physician and, have that diagnosis, done. But it's a process. There's many different types of assessments and tools that you must have to actually get a proper diagnosis. And a diagnosis can take anywhere from 6 months to a couple of years, really depending on, where you are in the disease process and the symptoms that you're showing. So, we encourage, you can use our helpline, you can talk to one of our clinicians about the diagnostic process, and, maybe what specialist you should be speaking to. Okay? I have one more. So I'm just going to be very blunt, as I tend to be, but we're looking at time, and I really want to keep our conference on time today. So we're going to take one more question so that you will all have time to transition to the next presentation for the day.
And by the way, to the gentleman's point earlier, you may know this or you may not know this, but you mentioned feeling exhausted. That is a very, very common feeling among caregivers, both professional and volunteer, non-paid, if you will, and it is extremely important that you take care of yourself as well as the caregiver. So the Alzheimer's Association has many resources that you can use for respite care, where you can turn to take care of yourself. You're not alone. That is a very, very typical feeling. So thank you for asking that. And again, like Annie said, I encourage you to attend the doctor's session and ask that very question regarding a diagnosis. Thank you. Another question?
Yes, good morning. To that gentleman that asked that question, I'm caring for my mother, my husband and I. It's going on 4 years, and she was diagnosed in 2016. And I can attest to the helpline. They actually talked my mother about her dog that she still thought was alive at midnight and calmed her down. So that's not the question, but I wanted to comment and give a plug for the hotline. But my question to you ladies and the state level and the political, I have been resourceful. My mother is not wealthy. She has a small pension. She does not qualify for Medicaid. So for those people who do not have limited resources and those who are not very wealthy, I feel we're in this bubble. And $38 an hour for that gentleman's mentioning he wants help in the home. My mother goes to the Hope Alzheimer's Center. I hire retired teachers. I'm a retired teacher. It's a lot of money. So what I'm looking for, and I appreciate the resources, I'm looking for, okay, there's volunteers at Lincoln High School. There's $12 an hour at the LPN program at RIC. I call them myself to get help, because my mother's lovely and, you know, still very verbal. So what we're looking for is a list, like you'd give us a list of places for respite. Who can give us some time now that the COVID thing, I mean, we're going to live with this and just keep getting vaccines, but my point is we need direct those of us, I mean, I'm not tired today, but full-time, 24/7 is a lot, and we all, those of us that do that, but we need a list of who can come into our homes that is safe, that are not the psychos, that are not going to steal from us, and I can't afford $38 from Visiting Angels and Bayada and all of that. So unless she's on a health care plan from a recent fall, that's what we're subject to. And in your comments to the General Assembly, my mother doesn't have those resources. And I don't want to put her in a memory care facility, because when she runs out of her money, she's going to have to go to a skilled. Medicaid and Medicare do not pay for memory care. So I just want to say, if in your work, give us a direct list that says, these are the places to give us free help. These places can give us a reduced rate. That's what we're looking for. At least maybe it's not just me, but we do need help at home.
Very common question, and I'm going to let Laurie answer that, I think, or at least start with Laurie. But before I do, let me say this. The Alzheimer's Association Rhode Island chapter in the 2021 General Assembly session pushed very hard and successfully, along with a number of our partners in the care industry, if you will, to increase the maximum income that an individual in Rhode Island can have, or can earn, if you will, to be eligible for Medicaid. For many, many years, we have been pushing to increase the income level, not the assets level. That's a separate subject, as you very well know, the income level. And we are very pleased to say that last session, Governor McKee signed into law an increase that makes individuals, single persons, if you will, individuals, eligible for Medicaid even at $46,800 a year in income. In addition to doing that, increasing the income level for those who are eligible for Medicaid, we were also able to get coverage for those who have been diagnosed with Alzheimer's but who are under age 65. As you might know, Medicaid previously in the state of Rhode Island did not cover those individuals. So you were left with those expenses, tremendous expenses, as you said. But now the state of Rhode Island covers all ages if you've been diagnosed by a physician with Alzheimer's, and we cover it at the single level by way of Medicaid to $46,800 in income. Married couples or filing jointly, to use an IRS expression, is higher. It's approximately $9,200 higher than that. But it was a huge win, and I encourage you to look into your mother's finances to see if she might be eligible for that, because we're not talking about asset-based tests. We're talking about income-based tests here. Laurie?
Yes, I'd love to share with you that the grant that we are implementing, being covered by the ACL, we are going to be providing therapeutic services free of charge. Okay? Those therapeutic services will be occupational therapists and speech-language pathologists, and will be providing additional support. It's not direct care, but we can come into the home and help you analyze different ways that you might make it easier to be at home for yourself as well as your loved ones. So we have a table here, CareLink. You can grab my card or some information, and we will be in touch with you, because we're really excited to be able to bring this right to your homes in order to help provide that service.
Thank you so very much. Let's take a break for about 15 minutes or so. Let's head out to the main ballroom and take a look at our vendors, ask any questions you might have, and watch the slide presentation, which will follow here with a lot of resources and information for you. But thank you for being here for the first morning session.
Hi, I'm Victoria Parker from the Alzheimer's Disease and Related Disorders program at the Rhode Island Department of Health. Our mission is to reduce the health and economic burden of dementia by monitoring the state's latest data, educating people and their families on prevention, diagnosis, and treatment, and improve the quality of care and support for people with Alzheimer's disease and related disorders.